好，各位朋友们，大家午安，我是 P-Force 的 Jeff， 在我旁边是 P-Force 的 CEO， 也是我们的 Chairman Dr. Sato。今天我跟大家谈一下呢，到底呢下背痛是怎么产生的，有没有哪些的方法呢可以来避免下背痛？那我们就请 Dr. 来跟我们开始来讲解这一段 ，please.
Okay, thank you. Hi, this is Dr. Sato from P-Force office. And today, I want to share some stuff that I often hear, not only from the coaches, but a lot from the personal trainers. Recently, I've taught some courses for personal trainers. I hear the term about the low back pain, so I want to introduce some of the mechanism for you guys.
他的沙鲁在过去听到很多的家长、教练，甚至开始在很多的健身房的教练这边听到的，就是很多的客户呢有下背痛的问题，就 low back pain。那他呢，就这是个非常好的一个议题来跟大家分享讨论，到底 low back pain 是怎么造成的，有哪些方法可以来处理。
Okay, so let's take a look at example here. So the idea is, where does it come from? Okay, where does that pain come from, especially talking about the lower back? A lot of time, if you go to massage therapists, okay, with a low back pain symptom, they will do somewhere around the lower back area to palpate. However, that might not be the actual cause for low back pain.
好，一开始呢要先来定义到底 low back pain 下背痛怎么发生的，所以我们从一个人体的构造来看一下，来分析 low back pain 是怎么产生。那过去如果我们去给人家按摩的时候啊，通常我们在如果说你有反应说我有下背痛，那当然按摩师傅会针对下背的部分的肌肉啊，这些结缔组织啊做一些伸展啊，或者做一些按摩啊推拿的方式。但是呢，也许那个部位并不是那 low back pain 产生的这个机制或者原因，所以我们来看一下探讨。
Okay, so I want to explain a couple of things here. Okay, so if you have some imbalance of the body posture or muscle strength, okay, chances are it changes the body position, okay, and then that might be the reason for low back pain.
一开始呢，第一个可能原因是因为如果你的身体的左右或前后呢不对称、不平衡，产生了这个肌肉张力的问题，或者因为你的这些动作不好呢，产生长期的一个单边的这个使用，都有可能产生所谓的下背痛的问题。
Okay, so the low back pain is not only the one factor. The low back pain is actually categorized for several different issues.
好，那下背痛的成因有非常多种，那我们在这边举例说明几种比较常见的一种状态。
The main example I want to put here is, let's say that SI joint symptom. This is actually a very common one that this part here, okay, has to be very stable, but due to the posture, due to the muscle imbalance, this one move a lot and then cause a lot of pain.
第一个这个叫健胯关节症候群哦，就是说呢，这个健胯这样的位置呢，事实上应该要非常稳定的，但有可能因为你的动作不是很理想，长期一个动作不好的一个状态，或者是一些动作外力的这个介入，让你这边产生一些受伤的情况，就产生健胯关节症候群，这是一个非常常见的下背痛的成因。
Especially people with a low back pain, when they feel it really deep inside, this is probably the symptom people get.
如果你的下背痛感觉在非常的内侧的这个组织里面呢，那很有可能会是健胯关节症候群。
The next one is actually not too much to do with the bone or joint. Okay, this one may be happening for the muscles. Okay, muscle spasming sensation, like when you walking around and trying to do something, and then you catch something like really painful sensation. Okay, it's coming from the muscle spasm.
第二种呢叫做肌肉痉挛，那它呢就比较不是所谓的骨骼或者是这种关节组织的问题，它是说，譬如说你在搬一个重物，突然用力了，就伤到了，突然间肌肉为了保护你，马上变一个紧缩的状态，产生肌肉痉挛，这种情况就属于肌肉痉挛的情况。
And then another one is actually something to do with the nervous system. So because of the misalignment of the bone, okay, it can pinch the nerve, okay, and then have some sensation going down to the leg, and then that's also very common low back pain.
那第三种也是很常见的哦，就是我们所谓的这个像 HIVD 啊，就是像椎间盘突这种的，就是神经产生，就是因为压迫到神经产生这种疼痛哦。 那这种呢，就是像很长的坐骨神经痛这种情况，也是很多人发生。那因为这种情况就是当你的这个像 HIVD 是你的软骨突出压到神经的，像你坐骨神经，所以在疼痛是会跑来跑去的，不是在单一一个地方的。那这个是困扰非常非常多人的一个症状之一。
Okay. So a lot of time, clinicians try to assess the body posture. This is very common to see that the people try to assess the body posture. While it's actually a good thing to do, it might not be the only symptom that we can find from the bad posture.
那这里呢有非常多不同的这个动作的这个应该说站立的这个模式哦，但不同的模式当然都有可能产生那下背痛的问题，只是产生原因成因不同。那我们现在就来分析不同的这样的一个站姿呢，都可能产生哪些的这个下背痛的这个情况。
So those of you who have been to my body assessment class, okay, I always ask those students, what would be the higher risk of these postures get some kind of low back pain? And then the answer that I always give to my students, all of them actually have a chance to get the low back pain because it's not only come from just the posture, it's coming from different sources.
那事实上，这5种站姿呢，都有可能产生下背痛的问题，那只是成因不同，那几率不同而已。那因为下背痛的成因来自很多不同的可能跟情境，所以这个部分先跟大家说明。
Even for the person who have a very almost perfect posture, if you have a muscle imbalance, if you have the habit to use the one side compared to the other, that can also raise the risk of low back pain.
比如说，在最右边这个，从这个角度看起来，好像他的这个站姿是几乎完美的状态。当然，如果呢，他有常常习惯使用单边的力量，或者他的左右两边肌肉不平衡，从这个角度是看不出来的，他还是有可能产生下背痛的问题。
So while postural assessment is very important, I also do too, but you have to check other parts of the body to see if there's any limitation from those places.
好，所以呢，上头的意思是说，从这个站姿来分析它可能产生的下背痛原因，这个是一个很好的一个角度，一个切入角度。但除了这个角度之外呢，还要从接下来的内容里面来看到更多可能的成因。
So in my body assessment course, I do a series of joint by joint, segment by segment analysis to make sure that that person can have a sufficient range of motion from each part.
所以呢，在大致上的教的这个所谓叫 body assessment 身体检测的过程里面呢，它试图从不同的关节的组织，从不同身体的部位批次性来分析，一层一层来分析你的这个关节活动度啊、你的稳定度等等这些的状态，来看你是否可能产生下背痛的问题。
So let's take a look at some examples here. So again, those of you who came to my course before have seen this kind of stuff. So this is a scapular retraction testing, and then this one is a spinal rotation assessment.
像这两个图啊，这两个影片，这个在做肩关节后缩的能力的分析，这个在看你的身体的脊柱的活动度的分析。
Some people ask, why do I check the scapula for low back pain symptom? Okay? If your scapula is always protracted or cannot move freely, okay, chances are it locks your spine so much, okay, you cannot move. So I want to make sure that the scapula actually very movable, but also stabilized in a certain position.
那很多人可能问说，下背痛跟肩关节差那么远，到底有什么关系？事实上，如果你的肩关节一直属于这样的一个状态啊，那事实上是把你的身体把它给抑制住了，甚至会影响你的整个脊椎的这个状态。所以呢，事实上，如果你长期处于这种动作的话呢，事实上你是会产生下背痛的可能的。
Okay, and then with the spinal rotation, if you have a very limited range of motion of the spine, when you try to rotate the body, something has to do more work because the spine doesn't rotate. And then typically it's coming from your pelvic, and then also lower body try to do too much, and then that causes a lot of stress in the lower back.
那像这个啊，在看你的整个脊柱的这个活动度，如果你脊柱活动度很差的时候呢，就产生代偿的可能。比如说你的这个髋关节啊，或者是你的下背啊，可能都产生一些代偿，那就可能造成下背痛的成因。
And then I do several other testing, of course, down to the shoulder, okay, sometimes on the neck and the lower body. But combining all that information, if I find some limitation, that can trigger to put more stress on the lower back.
所以除了检查这些地方，包括检查你的颈椎啊、你的胸椎、你的腰椎、肩椎等等不同的关节的活动度跟稳定度，都可以看到一些可能产生下背部疼痛的一些问题。
So doing assessment is very important. I always say that without assessment, you're basically guessing what works for that individual. So assessment part is very important.
所以呢，对一个你的客人，尤其是刚接触的客人，或者训练一段时间的客人，重新再做检测呢，都是让你帮助你更了解你的客人。那如果你没有做这些检测，其实你就是用猜的，代表你对你的客人的状态是没有那么理解的。
So let's go to the next step. Once you do the assessment, all the patients, whether it's athletes or general population, the next question I always get is, okay, what can I do to fix? Okay, so that's the most important part of us coaches and trainers have to know.
所以呢，当你做了检测，当你做了正确的检测之后，看到了一些状态之后，下一个问题一定是，那到底我要怎么帮忙他矫正，帮他把这些问题给解决？所以我们接下来讨论这个部分。
And I believe this is the missing link when I do body assessment course in different countries, including Taiwan. Okay, the assessment part is actually fairly easy to know how to detect limited range of motion. However, what to do to fix that problem is the most important part.
那大致上过去在包括日本啊，还有欧洲几个国家，像斯洛伐克、捷克、波兰都做过body assessment的这个课程教学。那事实上从这些所谓关节活动度的检测呢，看到你的客人的身体的这个限制的这个准确度是非常高的。但下一个比较大的挑战是，到底要选择做哪些的动作模式，跟怎么做来解决你客人的问题，是一个比较大的挑战。
Okay, so let's take some example here. When you actually prescribe the exercise routine, okay, you have two different ways to do the progression. Okay, one is called movement quality progression, and then the other one is called intensity progression.
所以今天如果你要帮你的客户开始产生一些矫正的行为、一些训练的这个规划的时候呢，有两个方法，一个就是透过动作模式的这个进步或者品质的提升来产生这个进阶的状态，或者是透过它的强度或者是它的阻力的增加来达到这个进阶的状态。
Traditionally, especially from the textbook information in the clinical field, I see a lot of intensity progression. Basically what it is you put more weight, you put more resistance to the body to strengthen the muscle.
在大部分的教科书里面，通常教你的是你放更多的重量，放更多的阻力呢，来强化或者是来刺激你的肌肉骨和神经系统，来达到进阶的目的。
But the ones I explain in my body assessment course is actually the movement quality progression.
但是呢，事实上他也非常强调，他的课程里面非常强调，从你的这些动作的进阶品质的提升，来达到所谓的这个进阶的这个目的。
This is for me very important part because if you have a poor movement quality, when you actually go up on the intensity, that gets more stressful for the body. So the movement quality has to be higher before you move up on the intensity.
也就是说呢，当你假设我们做5个阶段的进阶动作的安排，当你在第1阶的动作就已经没办法产生非常好的一个动作的控制或者动作的这个品质的时候，你要是不是要往2、3阶做的时候，到2、3阶你的动作模式会更糟糕，甚至可能产生身体代偿的状况。所以透过对动作模式跟品质的这个理解，来达到进阶目的是非常重要的。
So what I do in my body assessment course, I introduce level 1, level 2, level 3, some movement quality progression of doing a lot of scapular mobility work to make sure that the shoulder can go to retraction position. Okay.
所以呢，在他的课程里面呢，教到非常多关于肩关节，不管是后缩或者肩关节旋转的那种能力的这些动作模式。
And then I'll do a little bit of rotation with the resistance, okay? So the person can create more trunk rotation, okay, while stabilizing the scapula.
像这个就是他用拉力绳的方法产生阻力，然后要求这个教练呢做这个所谓的动作急速的旋转。那这旋转中，他还要维持核心稳定跟肩关节的稳定性。
And then the level 3, now I create this scapular mobility to be more on upward, downward rotation. Okay, a lot of people don't actually have this mobility when it comes to the scapula, so I try to make sure that the scapula move upward, downward rotation.
那这个动作的这是第三阶，第一阶、第二阶、第三都是跟肩关节有关的。这个动作在做肩关节的这个上下的移动，同时要保持它的非常好的稳定性。
Okay. If you don't have a very good progression, okay, you might overreach some clients' potential, okay, or you might do underreach. And again, the progression can give you the optimal zone of exercise selection.
所以，如果你没有这种动作进阶的这个分配的观念，你有可能做的对你的客户做的太高级动作做不到，产生受伤可能或代偿可能，但也有可能做的太轻了、太简单了。那客户觉得这个根本对他们没有产生任何的刺激跟进步。
Okay? So overall, this kind of stuff very complicated because you can go very deep. Okay? So I get questions from the trainers all the time. What kind of knowledge is necessary in order to do body assessment and then provide exercise prescription?
所以呢，很多人就问达克沙鲁说，到底我要知道哪些知识我才有办法来做一个好的 body assessment 来帮助我的客户。
And some of you might know my background. The biomechanics is my educational background, and more than 10 years I've been teaching what's called anatomical kinesiology, okay? How human body functions in the movement, okay? So this became very vital for me to perform body assessment.
那我们知道他是生物力学的博士，当然他过去在学校里面教很多跟人体的机动学有关的，跟人体的这个生理组成跟每一个关节活动组织、结缔组织互动的方式、联动的方式这些相关的知识，而这些知识都会帮助教练建立对身体非常好的理解。
So now that I have done several body assessment courses for the personal trainers, what's vital for them is to know the testing protocol from body assessment, and then knowing the range of motion of each joint, and then knowing the muscle function, okay, what kind of appropriate muscle function people should have. If you don't know these, very difficult to do body assessment, and then very difficult to prescribe the exercise.
所以呢，包括呢，差不多希望教练能够理解了，包括所谓的身体检测的所有的测试的方法。那再来要知道每一个不同的关节组织，它的这个正常的活动的范围应该是多大的，哪些是正常的情境，哪些是不正常的情境。那再来就是了解你的身体的肌肉是怎么运作的，怎么动作的，它跟关节的这个组织是怎么样的联动的，这些的相关知识呢，都是教练们当时我希望教练们可以理解的。
So let's do one example here. The shoulder and scapular movement, as I talked about how important it is to save the lower back pain. Okay, I'm going to do some demonstration on Jeff to make sure that we can get the right message to you guys.
所以呢，现在又请我做一些动作来说明肩关节跟这个肩胛骨的这些联动呢，这些关节组织的运动呢，怎么样来，它怎么透过这样的这个检测来看我的问题。
So usually what I do is to check the shoulder, okay, going to the side leg, first 30 degrees of movement, the scapula should not move. It's only coming from the shoulder joint.
好，这个时候呢，把我的手肘往外面摆了，在30度以内的情况下呢，我的肩胛骨不应该产生任何的动作，应该只能靠着我的肩关节来产生动作。
So I put my hand on his scapula to make sure that I don't feel any movement. And then from here, 30 degrees to 90 degrees. So next 60 degrees of range of motion, you should have 2 degrees and 1 degree. So it's a 2 degrees, 1 degree ratio. Every 2 degrees I raise, okay, 1 degree of scapular movement.
好，从30到90度的这个情况呢， 每肩关节每动2度呢，我的肩胛骨会动1度，比例大概是2:1这样的状况。
Okay, so when I go from 30 to 90, okay, what I want to feel is I want to feel a little bit of a scapular movement along with the shoulder. Okay.
好，这个时候呢，大家都会希望感觉到我的肩关节呢，会因为这个动作产生一点往外面旋转的这个状态。
Once it goes from 90 degrees, okay, from over 90 degrees, okay, it's a 1-to-1 ratio. Every angle from the shoulder, 1 degree of the scapula. So I should be able to feel same way it's moving between the shoulder joint and then the scapula moving same way.
从90度以上呢，肩关节跟肩胛骨的联动应该是1:1。那我的肩关节动1度呢，肩胛骨应该动1度。
Okay. So when I explain this in my course, actually I had not had anyone know this kind of anatomical range of motion, okay, and then the muscle function. Again, this is part of the reason why it's so important for me to teach this kind of practical material for those personal trainers.
那过去大特少在美国东田纳西州立大学教这些课的时候呢，事实上在授课的过程里面发现，几乎没有学生会理解这样的一个知识的背景，所以他才发现说，其实在当一个教练不能了解这样的知识背景的时候，其实是很难在正确的情况下帮他的客户的。
Oftentimes when I do this test, when I get the patient's arm up, immediately I can feel the scapula going up, okay? Or when I move the arm, the scapula does not move. Then I know something wrong with the scapular function.
有时候呢，他在做这个帮着客户做检测的时候，比如他动了某些部位呢，他的肩胛骨联动的非常厉害，或者反过来也有人肩胛骨就不太运动的。这个情况就代表从这些特征跟状态可以看出来，它是属于什么样的一个问题。
So once again, we start to offer courses for personal trainers, and then of course the sports coaches are more than welcome to learn this kind of stuff. The body assessment course, in my personal experience being a personal trainer and then also the training coach for athletes, this is so important to know to evaluate each person.
那我们当然现在呢，针对不管是运动教练啦，或者体适能教练或体能教练呢，都提供一些课程，来让这些教练能够学到更多的知识。那对 Dr. Sava 来说呢，他认为 Body Assessment 这堂课是对所有的教练非常非常重要的一门课程。
And then along with the body assessment course, I've also put some other courses together talking about physiological adaptation, more internal mechanics, okay? And then the pain management, and then more the technology knowledge, okay, for sports and fitness, and then down to nutrition, health, well-being.
那除了身体检测这个课呢，我们包括还做了像生理适应啊这样的课程，谈你这个卡路里是怎么样的，这个在你的身体里面怎么燃烧的，那包括你如何做肌肉的增长的这样的课程。再来就是说关于疼痛管理这个部分，因为等于是 Body Assessment 的更进阶课程，告诉你因为要怎么做，你帮你的客户做疼痛管理。另外呢，还有教你运动科技，比如说你叫 Push Band 啊、药球啊这样的运动科技产品怎么使用，怎么用这产品帮助你的客户能够做更精进的训练。就呢，包括教这个所谓的营养学啊等等，如何透过训练，透过体适能的训练，让你的客户达到更好的身心理的一个平衡跟满足。
Okay. As a personal trainer, when I was learning a lot of different stuff, looking back my educational background, these components helped really well in order to work with the clients on a daily basis.
过去 Dr. Sava 在他的生涯的起始的前3年，事实上是一个所谓的体适能教练，在健身房里面工作。他的客人绝大部分就是一般的这些爱好运动者，或者是就是一般的客人。那他透过这些知识的连结跟运用来指导他的客人，都发现这个效果是非常好的。所以他也觉得，如果我们这些教练们可以了解这些知识变一个系统的时候呢，对这些教练未来在指导的时候会产生非常大的效果。
So talking about the course offer, okay, we're already introducing a body assessment course for the last several times, and then now I'm adding that physiological adaptation, which is chapter 2, and it'll be available again in April and May time.
所以我们在4月跟5月呢，会同时在推出所谓的body assessment身体检测的课程，同时会推出生理适应的课程来讲卡路里是怎么在人体里面怎么被燃烧的，它的机制是什么，以及你的肌肉增长的机制是什么，来让这些教练们更理解怎么运用这些知识来帮助你的这些学员或者你的选手。
Especially for introducing a physiological adaptation, I believe this is somewhat new to a lot of personal trainers and sports coaches because this information I put together from the university level education, the stuff I used to teach about body fat loss and then also muscle gain.
所以呢，在身体适应这个课里面，事实上所用的这些教学的内容啊，是过去达特萨在东田大学州立大学在教他们硕士、博士班的选手用的这些教材。那主要就是告诉这些学生，你要如何帮你的客户或选手呢？增加你的肌肉量啊，怎么样减低你的脂肪啊？然后透过这些对身体机制的理解，之后达到这些目标。
So once again, we welcome you guys to join the course. So far, we've had a lot of people coming to the body assessment courses, and then we get a lot of good feedback, knowing different type of exercise as a progression, along with the actual assessment part.
过去这6周呢，我们做了3次的body assessment课程，在1月10号、10号做第4次。那有很多的教练来参加，也反应也非常好。那很多教练在反映，在上完课之后回馈说，他们在后来的这个训练上都可以马上可以使用这些知识。那我们也希望有更多的教练可以了解跟应用这些知识在你们的日常的教学活动中。
Okay, so if we have any questions, as usual, we're more than welcome to hear your concern and questions and answer appropriately.
好，如果各位有任何的问题呢，欢迎现在可以提出提问，或者是我们可以在会后来事后来讨论也可以。Coach Hong say your bubble tea is so cute. Coach Hong from Pingdong. Okay. So
Thank you.
Yeah. So actually, so some people say how to find the reason of the low back pain. Mm-hmm. So you mentioned that we actually test different joint, right? Test different part of the body, right? And then like a step by step, right? So do you have any like for example like cases which you can share with the audience?
Yes. So for example, okay, a lot of time people think that the tight muscle, okay, people who's not very flexible, okay, tend to have a low back pain. But actually, in my experience, not only the inflexible people, but also super flexible people can get the low back pain due to lack of control. So you have to have a balance of mobility and stability.
好，那这里呢有一个非常有趣的这个跟大家分享，就是说，过去我们都觉得说，如果像我的活动度很差，那我根本弯不下去啊。那很多时候觉得啊，你这个一定是活动度很差，所以你一定会有下背痛，或者你的下背痛就是这样来的。可事实上，大家稍微说呢，有很多的人呢，他的身体的关节活动度非常好，但是他还是有下背痛的问题，而来自于他事实上因为没有很好的控制能力，就他的稳定性不足，它也有可能产生下背痛问题。所以单纯从一个动作的活动度来看，并没有办法马上断定问题的本身。
So one example, the people with a really tight hamstring, okay? If you have a tight hamstring, your pelvis actually shift what's called a posterior tilt, okay? Your pelvis actually comes down, and then if you can look at my posture here, if your hamstring is tight, it brings your body down to this back posture, okay? So if this is the cause of that lower back pain, okay, instead of doing a massage, I would go straight to the hamstring to be able to stretch out, so automatically the posture changes.
比如说啊，像我们常讲的 hamstring 就是后侧大腿肌肉群啊，如果你这边是非常非常紧绷的，那它会把你的骨盆往下拉，就会产生像这样的一个动作。那这个动作就很可能产生你的下背痛的这个问题。那这个时候呢，与其去做massage、做推拿、去做按摩，还不如直接来针对你的这个所谓的后腿大腿后侧的肌肉群来做处理呢，会得到比较好的效果。
So this kind of stuff, again, the body assessment can tell us what's the weakest link, okay, what's the tight structure to be able to stretch out or do some exercise to strengthen those areas.
所以呢，透过所谓的 body assessment 这种检测模式啊，可以透过一层一层的分析来断定真正成因为何，而针对这个成因快速来做处理，不管是这个活动度的问题或者稳定性的问题，这样才能够彻底的解决疼痛的来源。
Okay, so this is just one example, but I've done the body assessment on athletes from the junior level to very high level athletes. Every case is different. Okay. Once again, if you know how to test, if you know how to prescribe the exercise, it doesn't matter if you're dealing with a general population or athletes. It should work the same way, okay, with different type of exercises.
所以啊，就是说，他过去的这个学员呢，包括从青少年运动员到甚至国际级奥运等级运动员，或者是一般的客人，就是一般的运动爱好者，只不过你能够了解这些知识的这些整个系统。你就可以用一个非常精准的方法来检测你的客户的问题，而且提出解决之道。Okay. Oh, okay, good question. So arch. Okay, yeah. So one people say, how about the foot? Foot, right? The arch is very low, right?
Yeah.
How to use, how to fix this problem? Because the arch to cause a low back pain.
So actually, this foot arch, okay, I actually talk about this in the body assessment section. The people who tend to have the flat arch, okay, think that it's a bad thing. But for me, it's actually not a bad thing, okay, because you have a more surface area contacting the ground, okay, that means they should be more stable. So chances are the people with a flat feet usually very tight musculature all over the body. Okay, so I know that the people with the flat feet, usually I focus on a lot of different parts of stretching. Okay, the question is what kind of stretch? Okay, what kind of exercise help to ease the pain? Okay, because we cannot change unless we use orthotic, right? So correct exercises will help the symptom.
OK， 低足弓的人或者扁平足的人啊。它事实上，它的照理讲，它因为它的地板跟它的脚的接触面积比较大，正常它的这个稳定性会是比较好的。但低足弓人通常它的整个后半部的肌肉群都会相对比较紧绷，所以呢，这个时候他都会使用一些不管是伸展的方法，或者一种动作模式的方法呢，来降低这些紧绷的感觉，来降低所谓低足弓对下背痛产生的这个成因。
So some of you who understand the biomechanics very well, the people with a very high arch tend to have a more musculoskeletal problem and injuries because their surface, contact surface is very small, so it puts a lot of stress to the body. They don't have a very good cushioning mechanism. So the way we do that in a body assessment course, we actually test the arch height from sitting down to standing. It's called a navicular drop test. Okay, basically how much the arch collapses. Okay, and then if your arch doesn't collapse or high arch, they have a higher risk of any type of injury.
有一个测试呢，这叫 navicular arch test， 那是一个非常特殊的测试法，是测试你的足弓的高低。那透过这个测试法呢，来判断你的足弓的高低。那比如你低足弓的人，可能要做一个这个所谓的这个叫做足垫嘛，哈。那高足弓的人，当然因为高足弓它的外侧啊就会产生比较多的这个张力，因为它靠到外侧肌肉来做这个支撑。所以不同的足弓的状态的人，我们必须了解这种足弓状态的状态，才能够来判断它的问题本身。
Okay, good.
还有没有其他的问题？好，那今天就到这边，谢谢大家。
Thank you.
Thank you.